Hey everyone, this is Jeff from Lewis Physical Therapy and Sports Rehab. I want to talk today about tendon management, specifically in any type of athlete or CrossFit active adult athlete that is having some type of cranky tendon with activities. And honestly, one of the easiest examples here is going to be some type of quad or patellar tendinopathy, because there's going to be heavy usage of that tendon from a jumping or plyometric explosive standpoint. But also, if you have someone that doesn't really do any of that plyometric jumping activity, but they do a lot of squatting or just squatting movements in general, like CrossFit athletes, you could very much have some of those tendon issues pop up. So starting with really, what are tendon injuries? One of the common ways that tendons are classified is as tendinitis. Now, the last part of that tendon, that itis, indicates that there's some type of inflammatory response. While there is an inflammatory response, the problem is it's not using the correct term in the correct time frame. So a lot of time, I'll see people where they're like, yeah, this tendon's just been bothering me for the last 5 to 6 weeks. And, I went to the doctor and I was told I have tendinitis. So not that there's not an issue with the tendon, there very likely is, but the inflammatory response, the itis of that tendon, has probably not been active probably since 48 to 72 hours after the initial injury had happened. After that time, it becomes a bit more of what we call tendinosis or some type of tendinopathy. And the osis part of the tendinosis indicates some degenerative changes in the tendon. So when we look at a tendon, we look at the tendon structure. It's this nice, parallel, smooth fibers that can accept and contract loads. It can jump, it can squat, no problem. It can take load without issue. Where tendons become an issue is typically when there's some type of spike in either their volume or their intensity, and that tendon just gets overloaded. Its ability to tolerate and withstand loads becomes weakened. And as a result, you get a cranky tendon. And at that point, once you start to, there's been some discussion in terms of what the tendon makeup is, or how it's, how it presents under really, we'll say a microscope for this example, is the tendon is no longer this nice, smooth fibers moving in parallel direction. There's a much more of this kind of disorganization of the tendon. As a result, when these tendons are disorganized like so, it can't accept and transmit force as well. And as a result, you then have a cranky tendon. So another common term that's used when we discuss tendons is what we call a stress shielding. So essentially, we'll just say this is your tendon here. We'll say right in here is the injured part of the tendon. Well, whenever you go to do a movement, or we'll just say even a very short duration isometric, which is commonly prescribed in tendinopathy management, is all the load gets essentially bypassed around that painful area. It goes to all the other areas of the tendon that are the quote-unquote healthy tissue. So as a result, you're now not getting load into that tendon, and that tendon needs load for it to heal. The only way that we're going to start to reverse that process of getting the tendons from here to here is getting controlled load through it. So the way that we go about counteracting that stress shielding is from these much more longer duration, slow isometrics. So that's why I like, when I do isometrics with patients, I like to try to get them up to doing it for 30, 45, 60 seconds, because that stress shielding, the longer duration isometric that we have, eventually over time, the stress starts to move away from that healthy tissue and gets into that injured tissue, which is exactly what we want. Again, the likelihood of you doing a submaximal isometric, we'll just say whether it's a wall sit or a seated open chain knee extension quad isometric, the likelihood of you getting stress to that tendon with a 10, 15 second submaximal hold is very unlikely. So that's why we'll go back to the patellar quad tendinopathy, for example. I personally, in a warm-up, especially for someone that's got a cranky tendon, which we know there's going to be some type of pain relief involved with these long-duration isometrics, I might have them do a split squat isometric for 30 to 45 seconds each side, and I might gradually play around with the height a little bit, depending on how cranky that tendon is, or I might have them do a wall sit, go from a double leg to a single leg to really just stress that tendon. Again, going from 30 to 45 to 60 seconds. So this, again, that is really how we want to go about, I think, in a more accurate way of describing what's actually happening at the tendon and these chronic tendon issues, And one of the ways that we go about getting some quick relief and load into that tendon, and that's those long duration submaximal isometrics.